Welcome to Victoria Rumble Room, a show that endeavors to bring you the important issues going on Vancouver Island, British Columbia, Canada, and the wide, wide world, the wide troubled world as it happens. And we have problems with a growing doctor shortage here right at home. We're going to talk to Camille Currie in just a few moments' time about that. She's running a petition. We want to hear a lot more about that because a lot of people are having trouble finding a doctor. And this is an exploding time. And speaking of exploding with his usual energy, vim, and vigor is the Croatian sensation, my co-host with the most, John Jurisic. And John, what a time.
My head is going to explode. Let me put that to you. Then you're going to have to find another host whose head won't explode from all these issues, all the insanity it feels like going on in the world. Yes, doctor shortage. I'm looking forward to hearing from Camille Currie from BC Healthcare Matters. And also joining us this week will be the mayor of View Royal, David Screech. Very, very unhappy about the lack of walk-in medical clinics closing on the West Shore. That was kind of, anyway.
They're all closing down, Johnny.
Right. There's no fine way to put that. There's not enough doctors in BC. But first, Robin, I want to talk again about Ukraine and the courage of the Ukrainian people, the inspiration that they provided to the world. They've likely saved democracy as far as I'm concerned. And of course, we can't avoid talking about the disgusting aggression of Vladimir Putin and Russia. It was really moving this past little while to see a huge crowd assemble on the front lawn of the BC legislature. Many folks draped in Ukrainian colors, all showing solidarity with that brave, courageous nation as they face the might of the Russian army. I suppose in retrospect, we might just want to know how mighty they have been. Nonetheless, these similar demonstrations have been happening around the world. I mean, around the world, there have been hundreds of thousands of people protesting what is happening in that part in Ukraine. Everyone is moved. Everyone is impacted. Everyone is emotional about this, except one person, and that person is Vladimir Putin.
And Vladimir Putin is out of control, and he's threatening the world. He's talking about upping the ante on nuclear weapons. He's moved his diplomats out of places like Canada. He's isolating Russia in much the same way it was once isolated when it was the Soviet Union. And he's banking to still prevail in this crisis with all of this rhetoric. So senior former national attaché, Chris Kilford, we asked him about all this rhetoric and this style. And this is what he had to say.
Well, this is a really good point, Robin, because I was sitting back the other day when he was listening to Putin on television, saying that if anybody touches us or tries to interfere, they will face the worst thing ever in the world, oblivion. And you know who that was? That was Trump. He sounded like Trump. Trump would do the same thing. He would tweet out, like, to the Turks, he said, if you get in our way, we will destroy your economy. Like, that's what he said, destroy your economy. If Putin said that to England, like, if you don't play ball, we will destroy your economy, we would be like aghast, right? We'd be, oh my God, this is an act of war. So when Putin was speaking, I thought, well, he's just picked up Trump speak and he's throwing it back at us because it wasn't the nuanced language of diplomacy that we're all used to. In fact, Russia's very good at, Lavrov, the foreign minister, is very good at. It wasn't that at all. It was Trump-esque.
He does it because he knows it works.
Maybe he feels it resonates somewhere in the United States or elsewhere, but it just like Trump, it sounded absolutely ridiculous, shameful.
Great to hear from Dr. Kilford. I mean, such expertise, such background, very lucky to have him on. And unfortunately, we'll likely hear from him again in the near future. We all stand with Ukraine. I stand with Ukraine. You stand with Ukraine. all of us are supporting this nation. All of us are supporting these people. We will keep on top of this issue and likely talk much more about it in the very near future. However, let's now shift to another topic that's really hot in this community, that being the BC doctor shortage. It's way out of control. There's no end in sight. There's no answer to this imminently coming about. 850,000 people, Robin, in this province, they don't have a family physician. Can you believe that? It's even worse on the South Island. I mean, talking about exploding. Something needs to happen. And you know what? There's actually somebody doing that. Some bold move is actually emerging within our community.
That's right, Johnny. It's someone who's come out of the Western communities, and she wants to do something for the province, but also for her family and herself. Camille Currie has health issues. She's a young woman, but she has health issues. She has a husband and a son. They have health issues. Losing a doctor is a crisis for her and for a lot of other people in this province, and she's not taking it lying down. It's an inspiration to see somebody really standing up for what they believe and doing something about it, even if it's just in a small way, trying to do something about this and change the equation. She's organized over the last couple of weeks an organization called BC Healthcare Matters. And they have a website at bchealthcarematters.com with a petition. And they are asking people to sign up and support this. They want this as part of the dialogue going forward. The petition reads, provide enough doctors and walk-in clinic options to take care of your citizens. Develop urgent and primary care centers. With this model, family doctors could work as salaried doctors. Provide increased remuneration to family doctors in line with other provinces. Develop a physician master agreement that will attract new family doctors and retain current ones. And finally, remove the restrictions on family practices and expand eligibility to transition to alternative pay models.
You know, Robin, those demands, they're very simple. Can you get us more doctors? Can you make the model work? Thousands of people have already signed the petition. It's online. You go there and you click, do it. Why don't we have enough doctors? And what can be done about it? So let's actually chat with Camille Currie. Let's Zoom her in.
Now, joining us in the Rumble Room is Camille Currie, who is the organizer of the Health Matters Group, the BC Health Matters Group, that have a petition that's going forward across the province to do something about the doctor shortage. And Camille, so great to have you on the show.
Oh, thank you so much for having me. It's a pleasure to be here.
Now, we just read highlights of your petition, and you already have thousands of signatures. So what's your end game here? What are you really trying to accomplish with this?
So I think, one of my primary goals is about informing. So I'd like this petition to get tabled into legislature. I'd like it to be read out loud. I would like all the MLAs and the Premier to hear the explanation within it, as well as the demands that have been listed, because I feel like there's a lot of misconceptions around this topic. And I feel like there's a lot of individuals that also just aren't well informed, that they don't understand the complexity of exactly how and why this is a crisis in our province right now. So that's kind of my goal and my hope for the petition aspect of it.
Camille, thank you for joining us on short notice. On your website at bchealthmatters.com, you reference the deep frustration you have about the exodus and shortage of family doctors. Obviously, that's why we have you. How has this affected your own family? And is this the reason you're taking action?
Yeah, I would I definitely have a personal part in this. And it is the way I was personally affected that got me going on this, 3.5 weeks ago. And that's that we have a very complex family when it comes to our medical history and the conditions that we live with. So when we got news that our family physician would be leaving in April, it really hit us hard. It struck us, gave us a lot of variety of emotions, and it kind of sent me on a bit of a researching frenzy to figure out, why is this happening and what can we do? Our family my children and my husband have a really rare genetic disorder. And so they're currently on an experimental treatment that suppresses their immune system. So we instantly had a lot of fears regarding the fact that by April, our only choices will be to take our children or my husband to the ER when anything happens. And to bring someone that's immunocompromised into a hospital during a pandemic is pretty terrifying to think of, when there should be other alternative options available. Myself as well, I have a variety of different conditions. I've had 3 heart surgeries already in my lifetime. I've had a pacemaker implanted, and I'm actually running down the clock right now, and I have less than a year left on this pacemaker. So I can't help but have that come to mind, feeling concerned about what kind of post-op care and what kind of follow-up I'll get after my new implantation. And will I be expected to go stand at an urgent care center for hours after heart surgery to be able to get the care that I should have available to me?
So you're that particular problem person that we hear about, that it doesn't really matter about age. There's people that are younger that definitely need to see a doctor more frequently. And we also keep hearing about, we have this rapidly aging society. The baby boomers are all demanding more services at the same time that we have fewer doctors. And, Camille, I look at what you've done in just a few weeks, getting this whole BC Business Matters website up and this petition. And I think, wow, it just shows what an individual can do. First of all, they're rattled and they're kind of angry about it, but also if they have some background and you worked with the federal government, you obviously know your way around communicating at this level, and that's helpful. So in terms of that, what communications are you getting back? What are you hearing from other people that are also frustrated? And what are you hearing from doctors?
Yeah, so it's actually been extremely enlightening. The amount of individuals that have reached out to me, and both from citizens reaching out as well as medical professionals on a daily basis. I'm having conversations with people, and I think I'm at about a coffee a day right now, 5 days a week, with someone that's willing to give me information on something. So from citizens, one of the most glaring things that I keep hearing is concerns over disease prevention. So what sometimes people, especially those that may have no medical conditions right now, don't consider is that the family doctor plays an extremely important role in disease prevention. So you may not have any issues now, but who's going to help you understand whether you have some that are developing in the future? And then if they do develop, how to get treatment for them. So that's a big one with citizens. Another one is that we do have a population that has quite a few complex care patients. And, though some may think, well, those people, I'm sure they have help. I'm sure they fit in somewhere. They don't. They often don't. And my family is an example of that. Just because we have complex care does not guarantee that you will have a family physician in this province. And as you mentioned, we do have quite an aging population. So many of them fall into that category of complex patients. So that's the second biggest one that I hear a lot about. And otherwise, a lot of emotion. Citizens that are mad, that are angry, that are in dismay over the fact that we've gotten to this point, and also really confused about how nothing is happening and how we don't hear about solutions being put forward. There are a couple solutions that the government continues to put forward, and that brings me back to often the communication I receive from doctors, which is doctors also, they reach out to me and they have a lot of emotion on this. They are angry, they are upset, they are burnt out and exhausted. They have come forward and shown me evidence of how many times they have tried to bring options to the table with the government to improve things, and how many times it's just been entirely disregarded. They have really helped me understand as well how the options that the government is talking about, which their leading one being the urgent primary care centers, how that is not a solution for us right now with the crisis that we are facing. There is a huge question about whether the finances for those establishments are being used appropriately, or whether the funds that it requires, such as the Oceanside Urgent Care Center at 1.9 million annually, or the West Shore Urgent Care Center at 4.45 million annual, whether that is the best use of funds, or whether the health ministry should be considering allocating some of those funds in different manners that would help us actually bring in more family doctors. The urgent care centers, again, what the doctors have enlightened me about is that there is this claim by government that they do provide a primary care need and that they will create attachments for patients to physicians. And that has yet to be seen. I believe there might be one or two within the province that have been able to do so. But in the West Shore, for example, there's been 0 patients attached to a doctor. There's, I believe it's approximately 500 patients that have received an attachment, but that's only to a nurse practitioner. And again, an example of the Oceanside Urgent Care Center up in Parksville, where there is an incredibly aged population. They don't even have a doctor on staff there at that facility. And it has been open for over 2 years, and they have not been able to hire a physician. So there's a lot of concern surrounding, if this is the government's solution, where are you going to get the doctors from? It's nice that you can tell me you're going to build a building, but what are you going to fill it with?
Wow. Amazing. Camille, you know, amongst the many hats I've worn over my lifetime, one of them is as a stockbroker, back when I had hair and I was much thinner, and you know, maybe 100 years ago, Robin?
At least, John, at least.
It looks like 5.
Oh, fantastic. Thank you. So
yeah, 500 years.
500 years, right. You know, I had doctors come and talk to me around financial planning, and because they're two very separate elements to their lives. They go to school intense, you know, they really learn about their profession, which of course we all want them to do. And then they have to go start a business of which they have 0 training. And, you know, and so that's really the sort of the crux of some of the problem here. So as you were talking about solutions, did you find that was referenced anywhere? How do we help the business side of having a doctor set up a practice somewhere in our communities?
Definitely. And it's been a really interesting conversation as well with physicians, because I've spoken with some that are adamant that they want to maintain having a private practice and being a business owner. They just need solutions in place and appropriate remunerations so that they can balance the books to make the business aspect and their profession work. So for some, that is still ideal. That is what they want to achieve. They're just not able to do it right now and make the finances work. But then there's another portion of them that really would like to just be salaried employees. And some of those, you know, they could be inclined and motivated to want to go work in urgent care centers, or even in multifaceted health centers. But there's some hiccups there as well. One of the large hesitations with the urgent care centers is flat out that even the doctors don't really approve of the way that those facilities are being run right now and the management of them. And they also don't feel like they want to support something that they don't feel is an appropriate use of the health ministry's funds for the citizens of our province. So it's also very endearing to see how much these doctors are trying to make choices as well that will not continue to feed something that is not functioning. And I really appreciate that about the choices that they have made. But yeah, getting back to your original question, there is the option of some that want to stay in private practice. And I think we can make that happen. I think that option should remain available. I think that there are some that want to go work in urgent care centers, and we're not going to get rid of all of them. I do think that we should consider whether we should continue building more of them at this point, but those that we have, let's reassess them. Let's do a makeover and make them more functional, make them more financially prudent, and make that an option for those other physicians that would like that model. And then there is a third model that actually exists, but it's not spoken about too much, and it's called the alternative pay model. And it actually has been offered to a couple private physicians here in Victoria already. They've taken it on. And what it allows them to do is that they're paid salary by the health ministry, but they maintain their building, they maintain ownership of the practice. So I don't know all the details of that, but it's a bit more of kind of a combo of both, I guess you'd say. And that works really well, they tell me, for low to average biller doctors. And there are plenty of those out there. So again, we have 3 amazing options that could potentially suit all the variety of family physicians that we have out there. But right now, just none of them are laid out in the right way for them to want to pursue careers in any of them.
Now, you live in the Western Communities, and one of the MLAs in the Western Communities happens to be the Premier of the province, John Horgan. Yeah. How many names do you need on this petition? I mean, how long is this petition going to continue? How many names are you hoping to get realistically to make any kind of a real impact here and catch the attention of the elected officials? What's your end game with this?
Yeah. So I don't really have a number in mind, actually, per se. I'm more about watching the momentum that it can grow and watching.
How long does it go? How long does the petition go?
It can go on endlessly, really. Some people have open petitions still, and some people can have them tabled with only 100 signatures on them. Other petitions get tabled with 30,000 signatures on them. So there's also no minimum requirement. And I've been advised that we have already drawn attention, and the Premier and the Health Minister are very much aware of our petition and our group. So I think we've garnered some attention already, and I'm fully willing to sit down and talk with anybody that would also like to explain the government side of things to me. So right now, I think we're just pushing and we're continuing with the momentum. This petition and this group are revitalizing citizens and helping inform and make them just a little bit more accountable and for standing up for what they need and what they deserve.
Isn't it great to hear from Camille Currie? What a great spokesperson. So articulate and knowledgeable on this very, very important cause. Let's hope government is listening. Let's hope they're listening. They should be listening. I know that civic government gets the message. Well, at least they are telling the same message. David Screech, the mayor of Royal, very unhappy that all of the walk-in clinics on the West Shore are closing. Can you imagine they're closing? And 100,000 people on the South Island, they don't have a family doctor, Robin. So let's zoom him in.
Now joining us in the Victoria Rumble Room for the first time is the mayor of Royal, David Screech, and great to have you on the program.
Thanks for having me on. Good morning.
And we have lots of things to ask you about. I think the most significant one off the top is the gradual disappearance of walk-in clinics on the South Island. For example, in your municipality, the Eagle Creek clinic is going to be going away from the walk-in capacity. It'll be appointments only. And I believe the same is the case in Colwood and the same is the case in James Bay. And for people who want that opportunity to go see a doctor, this is huge pressure. And I believe out of a population of 400,000 on the South Island, 100,000 don't have a family doctor. So what can you tell is being done about this?
Well, I mean, I think there's no doubt, as you note, that it's a crisis. We seem to use the label crisis pretty easily nowadays for all sorts of issues, but this is a crisis when you think of the numbers of people that don't have a GP. And I talked to a couple in their 80s last week who'd gone to the urgent care center in Langford and waited 6 hours just to get a basic prescription refilled. And we're hearing that sort of story all the time. So, I mean, I honestly don't know what is happening behind the scenes. I'm told that there's talks going on, but we haven't seen a whole lot of evidence of that or of progress being made. And it's, we're losing 2 GPs in Royal that have 3,000 patients attached to them. We're losing the walk-in clinic that a lot of people have availed themselves of. As you rightly know, there's another one in Colwood that's going, which will mean the entire West Shore will not have a walk-in clinic. And that is just, I mean, it's hard to fathom, hard to imagine.
Yeah. Great to have you on the show, David. I do believe you and I chatted, I guess, a couple of years ago on a podcast, like just as COVID was beginning. Who could have imagined here, 2.5 years later, we're chatting again, and there's less medical facilities available. Well, Chris, one of your major tenants is the Victoria General Hospital. I have to think the staff at Helmken Emergency, I mean, they're going to, obviously they're professionals, they'll do what they can, but they can't be entirely happy seeing the clinics close down. More folks are going to go there. That's just going to become the default place because they have no other choice. Have you had any kind of input from this tenant, the hospital?
Not too much from the hospital, but I think you're absolutely right. The more and more people will avail themselves of the emergency department that do now, or the urgent care centers just for run of the mill. And what the problem is that that's fine for one-offs, but they're not getting any continuing care. People who need that longitudinal care that they talk about just aren't receiving it. And it's just not adequate. My wife and I are losing our family doctor, with the Eagle Creek being closed. And it's a worrying feeling to know that as of April the 15th, we're going to join the 100,000 plus who don't have a family doctor.
Why don't we talk a tad bit about the elephant in the room, that being the premier of the province lives in the West Shore. He is now residing over no open clinics. Does this help in your lobbying efforts to get more medical services? Does it help having the premier as the MLA?
Well, I mean, I think there's no doubt the premier is acutely aware of the issues and the problems, and he would like to solve them. But this is one of these issues that for years we go to very partisan stances and people go to their opposite corners and take very hard line positions. And we seem to be unable to have a fulsome discussion about our healthcare system in general, and what its virtues are and what its faults are. And I just feel we need to have that hard discussion and see what we need to do to fix it, because whatever we're doing isn't working. All the mayors in the capital region met with Minister Dix 3 years ago at our last in-person UBCM. All 13 of us sat in a room with him to discuss the GP crisis in our region. And so that's 3 years ago, and not much has changed. In fact, it's got worse. So clearly the province needs to step up. And it's interesting on the local government side, because, for example, the Eagle Creek Clinic is looking to recruit, and they're looking to recruit in Europe and different places. But we're not allowed to, as a local government, assist them or help them in any way, because we're forbidden by the Local Government Act to assist a business. So there's all sorts of different ways that we need to look at this and problems that we need to solve.
We really appreciate hearing from Mayor David Screech. And, I have to say, I feel View Royal is being well represented. And this is the sort of dialogue that needs to take place. And we're glad we can do it on this show. Mm-hmm. And hey, the doctor's issue is grabbing a lot of attention from our viewership. So, Don, without further ado, let's go to some viewer mail.
I love this segment. We need to develop some kind of music as we intro into this, because it's so, there's a lot of action going on viewer mail. Here's my first message. Why not have government lease the spaces and hire the staff and pay the doctors a salary so they can spend time seeing patients, not processing paperwork?
It's nothing short of an abysmal failure on the part of our government at every level.
We've known for years that we have an ever-aging population, creating an unprecedented demand on our medical services.
You don't need more money. You need to start using our tax dollars more responsibly. So thank you for all that feedback. We really appreciate it, both pro and con. And yes, we really do look at it. So, if you're taking whacks at us, we see it. We don't always put it on our show, but believe me, we read what people have to say. We've received a lot of angry feedback from truckers, anti-mandate people, anti-maskers, people who don't like the vaccination policies. COVID-19, who can like that? We don't like it either, but we still believe that you have to follow a certain degree of health orders in order for us to get through this pandemic. That's our position, but we understand there's unhappiness. Let's talk about the truckers' dispute. The truckers, I believe, got out of hand. Now, locally, in British Columbia, on the lawns of the legislature, there were protests for 5 weeks in a row, and they were peaceful. People blew their horns, people marched around, there was angry signs, but people did not block commerce. They did not stop people from getting to their homes, and they went home at the end of the day. It was a peaceful protest. They had the right to be there. People in Canada have the right to protest. We live in a democracy. This isn't Moscow where you haul people away who don't like war. If you don't like war, you can march around in Victoria till the end of time, and people will support that. I'll support that. But with the truckers, they went into Ottawa with a different agenda. They went in there because they were determined to change policy instantly, and they weren't going to leave unless they got exactly what they want. Now, I think Justin Trudeau completely dithered. He should have met with them off the top and said, okay, we're listening. What do you want? Find a second solution, find a way out, give the truckers the feeling they've at least been listened to, and then move them on. He allowed them to stay for 22 days. They then started demanding there should be a change in government. They blocked the borders. They hurt commerce. At the end, he had to bring in special orders because he'd waited too long. And it's a shame that that happened. But the truckers have to know, yes, you have the right to protest. You have that democratic right. You don't have the right to break the law. And that's the way I see it. And with that happy note explained, at least from my perspective, it's now time to explain to our beloved audience how they can follow this show. They can like us. They can subscribe to the Rumble Room. John, take it away.
They can write to us, and they do. As you reflected, they certainly do. If you ever want to spend some time wondering how the public thinks about the issues we talk about, come to our Facebook page and read the comments. Look, that is the main sort of heart of the show. I encourage everyone to come and subscribe and read the comments. We also have a Twitter page in which we get a lot of activity as well. And certainly a YouTube page, which is where all of our websites live. Our websites, our videos. They feel like websites sometimes. And then, of course, we do have an official website, really much more of a podcast, sort of transfer to iTunes, to Google Podcasts, and getting us out into that sort of podcast streaming world. Then, of course, the fun parts, for me anyway, I really enjoy putting our interviews and clips onto Instagram and TikTok, which is really a very sort of, it feels like an unregulated platform. However, I might add, it's where a ton of live Ukrainian folks are posting their experiences. So not only on TikTok can you watch what we're doing, but you can also watch what's happening directly from the Ukraine. Nonetheless, time for us to end another week. And for now, once again, I remain the mayor of North Tulip Avenue, always a friend of the Ukraine, their people, and their community. I am John Jurisic.
And I'm Robin Adair. And in Ukrainian, the Kuyu, rumble on.